Can RLE and cataract surgery improve my mood? So I have some firsthand experience with this, well, not firsthand, but through my patients. I've had a lot of patients in rural areas who let their cataract go for, and it's overdue when we take it out. And they would often come back at the 1 month or 1 week mark and tell me, I love my vision, but one thing that I wanted to report to you is that my memory is sharper, and I feel like I enjoy life more. And I've had that folks tell me that quite a few times now. And more recently, since I've been doing mostly RLE surgery, I had a patient, a young patient who was 50 years old or so. We did RLE surgery with multifocal lenses, and he quickly developed posterior capsular opacification, so the scar tissue behind the lens. And we didn't really know about it. I think he had mentioned that the vision wasn't that great on the phone with me, and then when we came to see him, we saw, whoa, there's quite a lot of scar tissue, so we removed that. And the next day, he tells me, wow, it's so different. The vision's so clear, and I just feel so much joy, more joy than I did for the last month. And so yes, I really do think that having better vision, or having a better any other sense, hearing, taste maybe, it's going to give you better quality of life, and so I think that will put depression, put a lot of these bad moods more at bay. I think in the recent news we heard of in a foreign country there was a patient who was essentially blind with let's say white cataracts, and he was reliant on the family. I'm trying to tell you the opposite it can also be true. And what happened was that he was just so reliant on the family. The family was taking care of everything for him, helping him see basically. And then he got cataract surgery, and suddenly he can see and see really well, and he's back to his normal sight. But the family, I think, started to withdraw, the support that he was given while he was essentially blind. I think this patient didn't do well. I'm just making some guesses here. He became depressed, and then he, I think it just spiraled out of control for this patient. I read that in a article in my phone recently. So I guess the opposite is also potentially true, and that brings up a lot of questions now in my field. About how do we make sure that patients recover not only from their vision surgery, but also socially as well, and to be aware of these social situations that might might be really bad for the patient. So anyways, for the most part, it can and probably will improve your mood.